Thanks so much for joining us today. Tell us about vaccinate208.com.
We're really excited to have another resource for folks out there. There's a lot of people trying to help, but as the vaccination effort started, we thought, how can we be a solution there? We actually offered some technology solutions to the state. We've also offered to be what we really wanted to do, Melissa. I'm really worried about the disadvantaged, ill and those with comorbidities, and maybe those that with English as a second language. So we would love to do some mass test sites for those people that may be being left behind. We actually turned in a formal proposal to the state, and when that didn't go through, we thought, what else can we do? I think an awareness campaign is important for several reasons, and that's what Vaccinate the 208 is. One is it's just getting accurate information out there in another way so that people can look up and find out what the truth is regarding the vaccine. Secondly, we are translating everything we're doing into Spanish, because I do think that's been one of the holes in the pandemic, is getting information out to folks that they can actually read and digest in a way that makes sense to them. And then thirdly, nice cat, I like that.
She likes making cameos.
That's awesome. Thirdly, it's not ideal. Ideally, we would have had the technology so that we had a clearinghouse for these testing sites, so that you really connected patients to capacity. That would have been the way to do it. But when that didn't work out, we thought at least we can put a couple of our employees full-time calling around the state and at least automate some information to help people. So that's what the effort's about. We believe that awareness is the key to this, and all of us, doing our part to try to maybe take some of the misinformation that's out there about vaccinations and get people vaccinated. So hopefully we're part of the solution.
Now, going through your site, I noticed that it's pretty easy to use. I know if I'm in Cottonwood, Idaho, where I can go to get vaccinated, or at least who to try and contact for an appointment. What kind of efforts are your staff going through to get that information? Because I know individuals have had a heck of a time trying to do the same thing.
Yeah, it's, I got in trouble for saying this last interview, but the 90s called and want their technology back. Ideally, what we did with labs is we had daily electronically labs reporting capacity, and then we hooked them up electronically. So that's what we should be doing. But what we have is we have 2 employees calling every day and trying to keep that list as updated as possible, just trying to help people. It's not ideal, and it's not going to be perfect either, because if they call in the morning and things change by the afternoon, but we're trying to update that every day, just so that there's one place for Idahoans to go. Vaccinate the 208, go there, and we'll at least help you get started to where you're going to go. Again, it's not going to be perfect, but that's what we're doing. Very low tech phone calls, trying to update the website and at least have information out there that they can use.
Now, is this something that you would have done anyway, or was this a direct response to the lack of centralized information and the confusion that's already out there?
Melissa, I like to think that we're thinking out ahead 6 months. And I think 6 months ago, after watching what happened, if you listen, no one's really talked about what happened with contract tracing in the state of Idaho. It didn't happen. And no one's talked about just testing and the confusion. And it got out of control, right? So the next thing we thought about is, hey, in that same system of letting stuff filter down, you're going to have vaccinations being sent out to all these healthcare providers who, my goodness, they're doing the best they can, right? But it's going to overwhelm the system. So we started talking about it 6 months ago. We actually took the technology that we were using for testing and started tweaking it 6 months ago in preparation for saying, hey, someone's going to need to be thinking about this. And I've said to you before, we're helping other states with these same problems. Sometimes we act like in Idaho that somehow this is a unique problem for us. It's not. It's the same thing happening in other states. So we've been helping other jurisdictions with the same problem. So we've been ready to help, I guess I would say, proactively, knowing that it was probably going to be a bit of a cluster.
As I have looked at vaccination rates by county, I've noticed some big disparities. As your team has contacted all of these providers, have they noticed any disparities, whether on number of sites in a given region or availability of appointments?
Boy, that is a really great question. I don't think we know enough yet. I think over the coming weeks and months, we'll be able to track that, and we are. But right now, everyone is just scrambling because there's so much there's so much misinformation out there. There's so much lack of knowledge of, okay, when am I getting my next dose? What are we supposed to be doing? How much is the state getting? So right now we're just trying to get our feet underneath us, but that is a fantastic question that hopefully we can track that. Because as to your point, a lot of times we think, the great state of Ada, you got Ada and Canyon County, but you do have the rest of Idaho that's trying to figure this out as well. And as we know, going through this pandemic, that those rural communities get devastated and need assistance and help with these bigger issues. And that's the role of public health. So we're just trying to be a solution and a help for them.
Is this something, in your view, that the state could have done by itself?
Oh, that's a big question. I don't know. I mean, I just don't know how. I mean, you got a Department of Health and Welfare. You've got 7 health districts. You've got millions and millions of dollars that the state, I mean, sometimes we act like the state, the federal government hasn't helped us. Well, they've given us gobs of cash to deal with this, right? So I don't know. I wish I knew. I wish I was in the inside of their organization and knew what they were doing to address these same problems. We don't have that luxury. So we're a nonprofit. We have a little board of 6 people. We have a little staff of 9 full-time employees, and we're just seeing problems as they're coming and trying to be part of the solution. But my short answer was, I sure would have hoped so. I mean, with the amount of resources and people and everything else they have, yeah, I think they could have been a little more proactive and prepared for this.
You mentioned the federal government has given the states gobs of cash, but they've also given states conflicting information on how many doses that we are going to receive in the future. There's been a decentralization of data collection from the CDC under the direction of the previous administration. And so what more could the state have done with this
Well,
uncertainty and with the lack of direction, in some cases, from the federal government?
well, so 2 issues. I mean, listen, I am never going to defend the coronavirus response from the Trump administration, right? That's a separate issue. But I also can't sit here and pretend that the state of Idaho wasn't given hundreds of millions of dollars. There would be nothing wrong on your own initiative, which is happening in other states, to say, hey, this is dysfunctional, so we're going to try to figure this out and make sure that we're taking care of our own people. So just sitting back and saying, hey, it was their fault, they decentralized, they're not reporting, whatever. Yeah, that's all true, but it's not, it doesn't stop you from being proactive on your own and saying, okay, let's take care of our people. Melissa, we only have 1.8 million people in Idaho. I mean, there's not that many people to take care of right here versus other large counties and other places, the problems that they have in more of these urban centers. So with the amount of money, I guess the question you asked was, could they or should they have done something different? I'm just saying, with the amount of resources and money and people that they had, regardless of what Trump did, I would have liked to seen them be more proactive in preparing for this. And I think I think they've been given a huge pass.
You've also been critical of the legislature's pandemic response, and you said previously that you had hoped that they would be more proactive in helping with some of these issues. So what would that response look like in your view?
Well, Melissa, I had the pleasure of visiting all 7 health districts and seeing what they were doing pre-pandemic, what they were doing for vaccinations, what they were doing for lower income healthcare in supporting counties and local jurisdictions. It was a big part of what I did before, and there were giant holes in it. The other thing is the governance of our 7 health districts doesn't make any sense at all from a hierarchical perspective. I mean, how does this work? How do they function? So going into a pandemic, I actually hope that our legislator and our state and the people knew that we had some problems, right? So now we have a pandemic, right? And it's dominated our economy. It's had our kids out of school. It's been one of the hardest things that people have had to go through. I just thought that the legislature would have asked those questions. How can we improve our public health responses in Idaho? What are the holes we have in our local health districts? What are the ways that we could better fix some of these problems? Yeah, we're in the middle of a pandemic, but it's not too soon, Melissa, to start saying, let's be part of the solution so that we're better prepared to finish this pandemic out. And what are we going to do for the next time? So those are the things that I was looking for. And frankly, I haven't heard any of that. Instead, it's been, I think David Pate said it best. It's been, how do we strip more of the control from the governor? I understand that there's a primary election next year, right? I mean, we all get the joke. but you're also in the middle of a pandemic and you represent people whose livelihoods and lives are at risk. So I thought they would have balanced this a little bit between rallying to the base for a primary election and trying to help with some legislation and fixes to systems that affect people.
You know, we've talked about what the Department of Health and Welfare could be doing better in your view. We've talked about the legislature. So much of the public's response and lawmakers' response comes down to the information they are getting, and in a lot of cases, misinformation or conflicting information. What could we in the media be doing better?
Oh, that's a, you know, every time I get on with you, I don't mean to sound negative, because I think there's a lot of people doing the very best they can. If I look back at this last year at people that literally are putting in 16 hours a day, just all their emotional energy trying to help our community, our state, our people, I think the media has been doing that. I think you look at our local healthcare systems, the providers, the people that are really trying to get good information out there. I don't know, because I think they've been doing the best they can. And so I don't have, you know, I look at it as gratitude. I'm glad the local media has been doing the reporting they're doing. I look at a couple of specific instances. I look at Nicole Foy at the Statesman. I've never met her, but the stuff she's put out this last year for the Hispanic population in Idaho, you know, but essentially on her own as a local journalist, to me, that is work that has just made a difference for people. And, you know, as we've gone out to meatpacking plants and as we've gone out and help people that are disadvantaged, they all comment on that. Thank heavens that we're getting that information. So I don't have any criticism there. I think people have been doing the best they can, and I hope they continue to do that. We've got to find ways to come together. And I think the frustration that you may be hearing in my voice is government's got to be part of that. We can't force them to come work with people. They've got to decide how they want to face this pandemic. And I think during testing and contract tracing, you might have got a pass, but vaccinations are going to be different, because there's going to be a giant scoreboard showing how we're doing nationally.
You know, to anyone watching, I swear I did not pay Dr. Ahlquist to say nice things about the media. I promise I did not do that. As we look ahead, what's your concern for the next problem that we might hit?
You know, Melissa, one of the things that frustrates me, and I don't know why I'm built this way. Maybe it's because I'm an ER doctor, right? So we're always thinking about what's the next thing, what's the next thing, what's the next thing. You kind of triage, you get stabilized, and then it's what's the next thing. And we have not done that during this pandemic. So for me, we should be talking nonstop right now about the next school year. That may sound crazy, but we're in February, and by a fall of next year, where are we going to be with vaccinations? Where are we going to be with getting kids back to school? Because one of the tragedies of this whole entire response was, if we would have tested and traced better, if we would have had more cohesive protocols at our schools, we wouldn't have had the shutdowns that we've had. And so for people that are saying, hey, the governor did too much or people are doing too much, the reason why we did is we didn't have control of this virus. So now we've got a chance going into the fall to have the right protocols. My goodness, it's what they're doing in other states. We should be talking nonstop with the state health, with the state education board, with local districts, more of a cohesive response. I applaud David Pate for what he's done with the West Ada School District. I think he's looking at next fall already, but those are the things we ought to be doing now, is saying, how do we prepare for next fall and not waste the time like we did last summer. Last summer was crazy for me, because I kept just sitting back thinking, you know, we got this window. What are we doing? And the days passed, and then it was fall, and now we're almost back to spring, right? Where we're going to get this other next pass with the virus, but we got to get ready for the fall. That's what I'd be saying in every single way at every level.
Have you brought any specific proposals to the state regarding the coming school year?
We have not, because the last proposal we submitted to the state was wanting to help with the vaccinations. That was a proposal that went in a few weeks ago, and but we probably will. I look forward to working with David Pate, and maybe we can start coming up with some solutions. There's a lot we can learn from other states in preparation for the fall, so we'll work on that. Right now, it's Vaccinate the 208.
You know, since you brought up the primary election, one last question. Are you sure you're not running again?
Oh my goodness, Melissa, never.
Not for
No,
governor, not for anything?
not for anything. not for anything, but I'm sure you're going to ask me every time. No, no, you know, I listen, I think there's a lot that can be done well in the private sector. And I think that we need to come together as a community, as a state. And I hope that we can start healing as a country a little bit. I'm optimistic that we can. I'm really disappointed with some of the things that are going on in the legislature. So there's no way. Can you imagine me going through a Republican primary now? Just no way. I just it's not the right fit for me. And but I sure hope we figure things out as a state, because as much as people want to ignore politics because it just gets old, it's just tiresome. It matters. The policies that are created by the state matter to individual people's lives and families and businesses. So, you know, I encourage, there are some really great people in our legislature. There really are. They care about people. And I hope that they can keep their eye on the bigger picture, which is the people of Idaho, and avoid some of these pitfalls that you know, that are out there. And I think they get sucked into, and they're really good people getting sucked into some really bad stuff that they're talking about. And I just, anyway, I'm better at standing on the outside and doing some things in the private sector. We go pretty fast and hard, and hopefully we can be helpful. But yeah, that's a long answer to a short question.
Dr. Ahlquist, thank you so much for your time.
Thank you.